said that when I will be adult, I will become a doctor, but a doctor would not make children afraid. I choose nephrology. The main reason is that we don't have any nephrologists in my country. The Central African Republic is in heart of Africa, and it is a big country in terms of land because the territory is big, like France plus Belgium, but we are 5 million of the population. In this country, you cannot find a nephrologist. When I studied medical school, I wonder myself if people have kidneys problem, what they are going to do. And most of people who don't have money died. When I grow up, I would like to become priest also. And I went even to the seminarium for Carmelitanian in Central African Republic. And I would like to do something, I think more than that. I tell to myself that I have to learn science plus literature and things like that. So I decided to get out for the seminarium and to study science studies. And by studying science, I decided at last to become a doctor. And I told to myself, if I cannot cure the soul of people, I can cure their body. I'm belonging in a big family, and I have 12 father and brother and sisters, so it is a big family. And for a family, having a doctor is a kind of security. So I think even my father or my mother like really that I become a doctor. It was a big change in the country, in the health sector, because the first center of hemodialysis was built on 2020 in the country, but there was no nephrologist, so the center cannot work. And after 2 years, when I complete my study, on March 2022, I decided to go back, that things start to move. And I used to train nurses to have a new technician, because we don't have technician and nurses. I needed to ask for experts for the maintenance of all the hemodialysis machine and the materials, because they are there for 2 years, but no one used them, so the material was a little bit broken. And we start the first hemodialysis in the country on last May. Now people don't need to travel abroad to have healthcare in nephrology, because we have one university in Bangui and one medical school, but the students don't have a teacher in nephrology, a professor in nephrology. And that's what I'm doing. I'm working in a university hospital in Bangui, and I try to help as I can. Affording healthcare is a real problem in Central African Republic because we don't have any insurance system. So if you don't have money, you cannot be treated. The real cost for one hemodialysis session is like 80 euros. So the government try to support 150 euros, and 30 euro for the patient. But even 30 euro is so expensive for the patient. Someone who work like a physician like me can get around 500 euro a month. For example, if me like a doctor, I need to pay an hemodialysis session for my father or for my mother, I need to spend maybe more than 300 euro a month. I met Siriri the first time by one of the Karma priests who work close with me, and Siriri supported my medical school, my general medical school. Thanks to Siriri, I was able to complete all my training. And the other thing I try to do is to increase my social engagement, because it is something very important for me. I think that if we have a normal economic situation in the country, many things can improve. Yeah, if people have something they can do daily, they cannot be involved in violence, in war, and things like that. They can take care of themselves. I have hope for the future of the country. I think if we focus on the education of young people, we can change the thing. Maybe slowly, but we can do it. And that is why I'm so grateful for the support Siriri, the Siriri Association has given to me and continue to give to young people in Central Africa through training to have qualified professional in different level. In that way, we can continue to build a better future for this country.